The commitment, I guess, let's broaden this out a little bit then too. Okay, so is the administration actually doing something on opioids?
Trump just signed the Support for Patients and Communities Act. It's the most expensive drug combat bill ever passed. It's about $6 billion in funding. President Trump made sure to let us know that it's the biggest ever. And
what's that going to do? What's that bill going to do? Now that it's law.
First of all, the most important thing it's going to do is expand the patient camp for people who have licenses, doctors who have licenses to prescribe buprenorphine. At the moment, the most patients that a doctor who has a license to prescribe buprenorphine, which is a medication-assisted treatment opioid used to treat opioid abuse disorder, that is going to be expanded to about 280. So basically, someone gets a license, they're able to treat 30 for a year. After they do that successfully, they can treat 100 patients per year. And now, after this bill was passed, those people with the licenses, the doctors, can now treat around 280 patients per year. I think that's by far the most important thing the bill does. But the bill is actually a conglomeration of 50 other actions. And I think most of them are just expensive and virtue signaling in general.
I wonder. I was going to ask about what you thought the other day of the major arrest that was made concerning a distributor of drugs. In other words, there seems to be at long last, perhaps, some sense of accountability for what has taken place, which got us in some ways to this place. What's your takeaway on that?
Well, I've been reading about a lot of arrests. Do you remember which types of drugs specifically were in this arrest?
Well, it was prescription drugs. In other words, there were a lot of there was the big one, which was the doctors who were illegally prescribing drugs, and there was a case where a dentist had actually pulled teeth so that people would be eligible for opioids, and there were a lot of other made-up ones. But the other one I was thinking of was and I'm sorry, the name escapes me, of the drug distributing company that a former CEO was arrested the other day for the result of the practices they had. Supposedly, it was under the broad heading of profits for this company, as opposed to individuals who were in need of any kind of proper medication.
So any sort of arrest and any sort of prosecution that goes against pharmaceutical grade companies, I actually kind of argue might be counterproductive. What I find to be the reason why the opioid crisis is so bad is because we've actually had a large substitution of people using prescription-grade opioids, either recreationally or for bona fide chronic pain use, and them actually being cut off from their doctors. And because we've actually decreased opioid prescribing by about 50% since about 2011, we've had very consistent decreases in opioid prescribing throughout the country since 2011. Since we've done that, we've seen major substitution to the black market, and the majority of the increase in drug overdoses that we've seen has all been fentanyl and heroin. So, if a company's participating in illegal activity and consciously trying to get people addicted for profits, I can totally see why DOJ should go after them.
Yeah, the idea is that it does seem that somehow that maybe people are being held to account for this, and we still wonder, of course, I guess what is part of the reason is wondering what was at the root cause, and we have an addiction problem in this country, whether it's slightly up or down. Opioids have been the latest example of this in a lot of different states, and I'm wondering if this is all going in the right direction in your estimation, because you follow this stuff.
Well, the government at all levels, local, state, and federal, has been applying the same approach to opioids for about the last 20 years, and basically the war on drugs in general since 1970. And we seem to keep continuing the same approach. And since 1970, we've seen about a 550 to 600% increase in all overdose deaths resulting from illicit or recreational use drugs. I do not really think we're going in the correct direction. And the reason why I don't think we're going in the correct direction is I think we're actually misdiagnosing what the problem is. There's this notion that doctors prescribing too many pain medications got a bunch of people addicted to their own pain medications. And if you look at the SAMHSA data, the Substance Abuse and Mental Health Services Administration data on opioid pain reliever non-medical use and non-marijuana illicit drug use, it's actually been remarkably stable for the last 20 years. At least according to the SAMHSA data, I'm not really sure if we even have any higher percentage of the population addicted to drugs than we did in 2002, which is when the data started to be reported. And if that is true, then that means we've been targeting prescriptions without prescriptions possibly causing more addiction, which means we're just making the drugs on the black market more dangerous. So I don't know. I really fear that if we keep lowering prescription rates and basically coercing doctors to not prescribe pain medication at all, patients that need the medication who might not be receiving it, chronic pain patients, might be substituting to the black market to get pain relief. And people who are addicted to drugs, the supply that's on the street might, on average, consist of more deadly substances. I mean, if you look at Prince and Tom Petty, they both died from counterfeit OxyContin drugs after they couldn't receive, oxycodone. I'm not sure if it was OxyContin specifically. Oxycodone is the main ingredient in OxyContin. But basically they had counterfeit drugs that they had to go purchase because they weren't able to receive them from their doctors anymore. And I think our efforts to try to reduce prescribing to reduce addiction is making the supply of drugs on the black market much more dangerous. And if the reduction in prescribing is not affecting addiction rates, we're really just spinning our tires and just making the environment for drug users more dangerous.
We will watch as this conversation obviously will continue for some time, as it has for some time. Jacob James Rich.